Welcome to the Sniff Spotlight Series, brought to you by Renewal Rehab, a dynamic therapy company that provides full-service therapy for nursing homes. You'll be hearing from some of the leading nursing home professionals in the country, as well as many healthcare heroes that are sacrificing day in and day out to help your loved ones recover and come home to you.
I'm here with Eric Harter. You're the president of Rapid CPAP Supplies and Testing. Your team's single mission is to make an impact on the world of respiratory, particularly subacute care. Can you tell us a bit about what you guys do?
Sure. I appreciate being on with you today. We are a full-service respiratory therapy company. Our primary customers are nursing home patients and then also hospice patients. So we provide everything from the services caring for the patients to the durable medical equipment and disposables. And then in addition to those services, we specialize in stopping patients from unnecessarily going back to the hospital or unnecessarily coming off hospice services due to respiratory difficulties. So the typical nursing home is running around 20% of their respiratory patients going back to the hospital unnecessarily, and our program runs around 2%. So we're dropping that readmission rate down significantly through our services. So I'm a respiratory therapist by trade, so I'm not just a email guy on the computer here, but I have taken care of patients for many years. I've been a respiratory therapist for 20 years. And so I've been involved in every part of our business and every part of the respiratory world for the last 20 years.
So how has the COVID, I know with COVID coming out and things being very difficult in nursing homes with many of the elderly, how has this, your business and business model been adapting to these significant changes?
Yeah, so it's definitely thrown a wrench in what we do and how we do it. I think first off, I would start with our staff. Going in and having to wear a mask all day, every day, and not just a regular mask, but in many cases the N95 mask, which is the very intrusive sort of mask that's even difficult to breathe out of, has been quite a challenge. And then, people are exposing themselves to patients that are positive on a daily basis, and they're in fear of bringing that home. And it runs the gamut of people that are going home and just trying to live their lives, or other people that are now separate from their families that are living in apartments or vacant, basements of people's houses or motorhomes or what have you, where they're trying to keep, their children, their loved ones safe. So we have seen a lot of fatigue in terms of our staff members having to deal with this. And, they are really heroes out there on the front lines taking care of these patients. As we all know, the nursing homes have been, in many ways decimated with this virus, and it's changed the nursing home world probably forever. So just from a staff standpoint, it's been quite a challenge. Now, in terms of the patients, I would say that the patients are certainly struggling. They're obviously not allowed to see their loved ones face to face. They're not allowed to go out into day rooms really anymore. Their interactions with their friends that they've made in the facilities has changed. Their access to the caregivers. These patients and caregivers develop relationships, and if you're seeing these people every day, they develop bonds. And so, sort of the touching and interaction is decreased now because patients are afraid, staff are afraid, and you really have to be cautious. So I think the connections have decreased significantly, for staff, for patients, and for family members that can't see their loved ones. That creates stress.
Eric, being a leader in this space, understanding the patients may not be able to see their loved ones as often as they would like, and just they're not getting as much a human connection as they can. Have you guys been able to perhaps maybe given some training to the therapists that do have, even though there is some distancing, but to give them a little bit more closer touch, like an empathetic approach to the patients while they're going through these challenges?
I think that's a real challenge. I think because of the PPE that's required now, you can't even see a smile anymore. I was just at a nursing home not very long ago and meeting with about 10 different people. And I even said at one point during the meeting with a mask on, this is the point in the meeting where I smile. And, you had to explain to folks that you were smiling. So I think the PPE challenges you're not making the connections that you were making previously, in my opinion.
So Eric, as family and patients are looking to discharge into a nursing facility, what would you say that family members should be looking for in terms of respiratory support?
So, because we all know that this virus is a respiratory virus, and what it's doing is creating what we call a secretion problem, a lung problem, a breathing problem. And so as the family and patients are looking for a nursing facility that can support their respiratory needs, they want to make sure that the nursing facility has the respiratory support that's needed. Back in the old days, it was basically a lot of long-term patients that were in nursing facilities. And I like to say that the nursing home of today is the community hospital of yesteryear. So certainly with PDPM, the nursing facilities are taking a much, much higher acuity patient. And there's no more immediate problem than a breathing problem. That's not a we'll figure it out and fix it later type of problem. That's that we need to fix it right within the next couple minutes problem. If I was looking for a nursing facility for my loved one or myself, I would want to make sure that they have access to a respiratory therapist 24 hours a day via patient visits, via someone in the building, via respiratory telehealth, and also access to the high-tech respiratory equipment that's now needed to overcome many breathing issues. So no longer nursing homes are just doing oxygen concentrators and maybe a CPAP or two. They're in the midst of being, in many cases, sub ICUs in some regard. So that's what you want to make sure that they can handle your current status or the status if you get worse without unnecessarily sending you back to the hospital a bunch of times, because nobody likes that.
So Eric, as the president of Rapid CPAP Supplies and Testing, you're coming across nursing home owners and operators. What would you tell them? They need this respiratory therapy. Why would they go with you guys over some of the competitors?
I think our company, and God bless the other providers, I love our company. I love what I do. I love our staff. I love our, how we operate, and I love our customers. And the only way that I've gotten there is by listening to customers, right? Listening to their pains, listening to their needs, listening to their issues. And even in times where we didn't provide a certain service, we figured it out. You know why? Because the customer asked for it. The nursing home needed it. And we figured it out, and we had to provide for that. So I think that's really important when you're looking for a respiratory company, that they're more interested in your needs then they're interested in telling you how they do and what they do. So the days of respiratory medical equipment companies only doing X, Y, and Z and telling many facilities no over and over and over on, we can't do that, we don't do that, there's too much risk associated with that. Nursing home operators and administrators don't want to hear that. It's just noise now. They need to have their patients cared for when they need them cared for, and that's the bottom line. And if you're a respiratory company that can't provide for that, you shouldn't be in the business, to be honest with you.
So there have been a lot of precautions taken to help the patients, to really keep them safe during the time. Do you feel there has been open communication between, some of the regulatory government bodies and the providers?
I don't know that I would be an expert on that. I think that there has been lots of changes ongoing. Obviously, we've never gone through this before, right? The last time was 1918, and I was just a young man at that time. I think there's been a lot of changes, and we're doing testing monthly, we're doing testing weekly, we are doing negative pressure rooms, we're buying machines to do negative pressure rooms, we're putting patients in one wing of the facility, we're taping off that whole wing, and we're having separate staff over there, and then we're doing, and some facility, it really depends, they do it differently in different facilities. And so I think it's been a real challenge. I think besides the nursing staff and respiratory staff that have been taking care of the patients and exposing themselves for all this time, I think that the administration has had a really tough time. They're responding to the operators and the staff and the governmental agencies, trying to please everybody and do a good job for everybody, the family members and so on. So I think they've had a really rough go of this time. So from a governmental standpoint, we have limited interaction in terms of that. So yeah, that's what I would say about that.
So growing up, you wanted to be a star shortstop for the Los Angeles Dodgers.
Absolutely.
Now you're, a little bit of a career change.
Just a
now,
smidge.
Saving some lives, helping people's loved ones come home to their families and be safer. So what would you tell yourself as a child? Like, now you're a real hero.
Well, okay. Well, I don't know. I mean, yeah. So I think that, to be truthful, from the time I was a little kid, I was always interested in helping people. That's the truth. And for a long time, I was involved in that, even in my early 20s, my first respiratory therapy job at a hospital in Southern California. I found myself recruiting doctors and nurses and meeting with the CEO of the hospital to get their unused medical equipment, and then setting up medical clinics in other portions of the world, and got involved in not-for-profits, setting up medical clinics in Africa and Mexico and South America. And so I have always been very interested in helping people. Yeah, I mean, at the end of the day, I always tell people that I'm thankful that I'm not selling golden staplers for $100 a stapler, because I could never do that. I absolutely believe in this business and our helping folks, and even on our worst day, our respiratory therapists are out there taking care of patients. And so that's something I think that you can be proud of.
Where is Rapid CPAP and Eric Harter going to be in 10, 15, 20 years?
That's a great question. I think we'll be here taking care of patients. I think we will continue to be given more opportunities, because I believe that we're always going to listen to the customer's needs over ours. And I think if there's a statement that is basically consider the needs of your customer before yours and watch them beat a path to your door. And I truly believe that. Now, do we do it perfect every time? Of course not. We're humans. We have complaints. But I assure you, you're not going to get transferred to the wheelchair department when you call. We pick up the phone. We pick up the phone 24 hours a day. We get patients seen right away. We're always listening. We're always wanting to grow and be adaptive and listening to the needs of the patients. So, will I necessarily be in the business 10 to 15 years from now? I don't know that, but I think the model that we've created will absolutely be around in terms of having a medical equipment respiratory company that really is listening to the needs of the patient. Absolutely will be around.
Thank you so much, Eric, for taking the time. It was really a pleasure to meet you. I wish you guys a ton of success, continued success, and keep changing the world and making it a better place.
Thank you so much. I appreciate being on with you, and I'm glad we became fast friends, and I look forward to the future.
Thank you for listening to the Sniff Spotlight series. Please subscribe to our channel as there will be many new and exciting episodes from our healthcare heroes.